Hello, please subscribe and like for our channel. Thanks very much. Hello. Now, in this next question, in question 53, this next case too. We have a 53-year-old man, bricklayer, resident in Douala, that complains of a left flank pain of sudden onset. So they're asking you for interpretation. So in this interpretation, you can visualize if you see at the level of the left flank, you can visualize a small dark, you can see a small white opacity there. If you see very well at the level of the left flank, you see a left white opacity there. Is it clear? That left white opacity is going to correspond to a stone. Is it clear? It corresponds to the ureteric stone. Is it clear? We have the ureteric stone can be divided into three. We have upper ureteric stone, we have middle ureteric stone, and we have lower ureteric stone. And this is just a plain abdominal X-ray that was done. So your interpretation here is that you can visualize a small opacity. Is it clear? A small nodular opacity at the level of the left flank. Is it clear? That position shows you the pelvis, the renal pelvis, or the upper ureter. Is it clear? So those are the different things that you have to understand. Now, what is your diagnosis? Now, here you cannot directly and obviously say that it is the renal pelvis, nor the kidney, nor the ureter. Is it clear? So you have just said that you can visualize a micronodular opacity at the level of the left flank. Is it clear? Now your diagnosis here, you just say urolithiasis. Is it clear? Just say urolithiasis or urinary stone. Don't say the precise location, because on the X-ray you cannot visualize the precise location where it is. We cannot actually clearly say if it is in a kidney, if it's in the pelvis, or it's in a ureter. For you to say if it's a renal stone, a pelvic stone, or a renal pelvic stone, or a ureteric stone, you cannot clearly say that. Now, the next thing that you have in the question is any single paraclinical exam to confirm your diagnosis. Is it clear? Now, you need to know that every time you are the first diagnosis when you want to manage a patient that has urolithiasis or urinary stone, your first diagnosis is divided into two. Is either you do an abdominal X-ray, a plain abdominal X-ray, or you do an ultrasound. Is it clear? An abdominal ultrasound. Those are the two major things you first ask. You either ask for a plain abdominal X-ray or an ultrasound. Is it clear? So that one is going to give you the diagnosis. Now, to further be sure of the location of the stone, is it clear? To have the complete and full diagnosis, you are now asked for a renal CT scan with and without contrast. Is it clear? So that is what is going to tell you, that single paraclinical investigation is what is going to confirm your diagnosis. As in addition to confirm the diagnosis, it's going to tell you the location, it's going to tell you if the kidney is even secreting, it's going to tell you if that stone is obstructing or non-obstructive, it's going to tell you the size of the stone, and it's going to tell you the comparative size of the ureter, if that stone is capable of being managed medically or you require a surgical management. Provided that the stone size is greater than the ureteric size, it means that that stone can never pass through the ureter, so it's going to require a surgical management, and the surgical management can be either done via open surgery or it can be done via a laser fragmentation or a pneumatic fragmentation or a percutaneous nephrolithotomy. Those are the different management that you have to do in the stones. Is it clear? But now, if the stone is smaller, generally when a stone is less than 1 centimeter, it can be managed medically, but you have to also compare with the ureteric size. Is it clear? It can be managed medically or even managed with the extracorporeal shockwave lithotripsy. Is it clear? So those are the different management that you have to take in consideration. Medical management is when it's generally less than 1 centimeter, but you have to compare it with the ureteric size, and all that is being given by the renal CT scan with and without contrast. Now, the next question that is being asked is, what general measure will you take in this patient? The general measure that you have to take in this patient is to drink a lot of water, fluid rehydration. But now, there's a point I want to tell you. If the patient, you have to note that what generally patients have pain, and this pain type is colicky type. Is it clear? And in particular, in this patient, he's a bricklayer, so he's doing much exercise and highly dehydrated. That's a risk factor why this patient is highly to have what? To have your renal stone, to have this urolithiasis. Are you understanding? Now you have to know that what they say, what general measure, you have to know that this pain that patient complain are usually chronic in character, meaning that it comes with a very high intensity and then it suddenly go. Now you have to know that the general measure of fluid rehydration is when you are out of pain. Are you understanding? So every time that the patient is in crisis of pain, don't give him fluids. Is it clear? Instead, reduce fluids, because when patients are in crisis of pain, it means that there is obstruction and there is contraction of the ureter prior to the stone, or contraction of the urinary tract before the stone. Is it clear? So if you give more water, it's going to accumulate again more before the stone and cause more contraction and cause more pain. So you instead give the general measure of pain management when the patient is out of pain, meaning that the patient does not have pain. Is it clear? So a general measure is fluid rehydration. So then let's go to the next question.